Okay, are we ready? We're on. Okay. All right, always things to do. Good morning, everybody. Nikki Burnett here, Taste Life Nutrition Radio and podcast streaming live on
Unknown caller.
Well, there you go. And a call's coming in. Streaming live on KUHSdenver.com. Where today is really, I say a lot that I'm giddy about the show because I am. I think that we have really amazing guests, but today is really super special because there have been things that we've been working on for quite some time. On top of the guest who we have, Dr. Raj TerKonda, who is a specialist in, I tried to say this earlier, so it's facial and reconstructive surgery, otolaryngology.
Otolaryngology. Yes.
I was trying to say it on the promo, and it was awful. I totally messed it up. Anyway, it was really funny. I thought it was funny anyway. It was just me talking. But anyway, and sleep. And so we're going to get into why this is so special, but this is such a special show, and I'm so excited to share this with everybody. So first off, thank you for being here.
Thank you for having me.
You're here. Yeah, this is so exciting. And then, of course, as always, we start the show with gratitude. I need to turn my music down because gratitude can change the world. I truly believe that, and I think it's important that we take the time to be grateful every morning, every evening, throughout the day, whatever that looks like for you, because it will change attitudes and it will change the people around you, and it's just so much goodness that we can bring out in the world. So, what do I need to fix? 2 and up or down?
Yes, you got it.
Yep. So we've been doing this now for 4.5 years, and probably every time there's something I have to fix, but that's why I'm not the techie person. So, what are you grateful for?
I'm grateful to be here. Thanks for inviting me.
Yeah.
I'm grateful to be able to do what I've been doing for now almost 30 years and continue to love what I do.
Mm-hmm.
And just continue for my mind to be stimulated with my practice. I like talking to people. I like being with patients. And I like doing facial plastic surgery, skincare, and sleep. It's a kind of an odd combination. And we'll talk about how I got into this.
Mm-hmm.
I'm grateful to have some, at least, stable hands throughout these years and not be shaky. I'm grateful for my wife and my family and my dogs, and I'm just my goal is to always try to be at peace, which is really hard in these days, and so it's in progress, but I'm grateful to have peace in my life.
Yeah. Well, and I think like anything else, it's a practice, right? You practice medicine, I practice nutrition, I practice gratitude, you practice peace. We should all practice peace. I think it all goes together. It is a practice, and going a little bit off a touch, but one of the things that can bring us peace and bring us gratitude is taking the time for ourselves and taking the time for prayer and taking the time for meditation. And those are the things that help us to center. But that's what also helps us then to put out whatever goodness we have into the world when I say gratitude can change the world, that's truly why I say that. I think that it brings us some peace because things can be crazy and unstable, and that's life. Life is never really stable. So that's
true.
It is true. So that's great. My favorite thing about this show is bringing on people who love what they do, who have a story, who are here to share and to give and to serve and to love. And that's what Dr. TerKonda is all about. And so before we get in, I need to, of course, talk about what I'm grateful for. And I would say it kind of goes along with what this show is this week. We have been working on this project for months and months for us, whereas the founder of this project has been working on this in his head for 25 years, right? So Dr. Melamed is the sort of his brainchild is what we're calling ImmunoWellness. And I've been blessed to come in and be a part of this. Dr. TerKonda is a part of this, and we are coming together to bring together conventional medicine and holistic medicine and lifestyle medicine all together to really build what is different in the world of medicine, to bring it all together to best serve clients, to best serve patients, to bring the best care that we possibly can. And so it's actually coming to fruition, and we're not going to go too deep into it yet because we still are working through the processes, but this is a really big deal. So grateful, really grateful to have been a part of this and to be able to move it forward and to have such an amazing team that I'm surrounded by. So here we go. Yeah?
Okay.
Yeah, awesome. Okay, so let's do this. I want to know, I think everybody wants to know how you got to where you are, what brought you here, what you did in your past. You have a really cool history with people who you've worked with and who you've trained with. And then, what excites you, what motivates you in all of this world of surgery and anti-aging and health and sleep and bringing it all together, right?
Okay.
Yeah.
Well, that's a lot of information I'll have to try to get to you. We can start from the beginning, but
Yeah.
my parents are from India originally, and they came here in 1964. I was born in Texas. I
Ooh,
grew up in a
Texas.
small town in
Me
Missouri.
too.
And so I went to medical school at the University of Missouri, Kansas City out of high school. It was a 6-year program that took high school students, and it was a combination of undergraduate and your graduate degree. And then the postgraduate training, at least in medicine, is called a residency. So I did my residency in ear, nose, and throat surgery, which is also known as otolaryngology, head
Say
and
that
neck surgery.
5 times
Yeah.
fast.
But most people don't know this, but at least 25% of training in ENT is facial plastic surgery. So I had some great mentors at the University of Minnesota where I did my residency. And then I did a fellowship, so that's another specialized training at the University of California, Davis in 95, 96. So that was really where I got introduced to skincare and my interest in skincare. So my fellowship director was Dr. Jonathan Sykes, and there was a dermatologist on staff. His name was Vic Nararkar, who unfortunately is no longer with us, but he really stimulated my interest in skincare and in lasers also at that time. So that was, over 20 years ago. I've been practicing nearly 30 years ago. So moving forward, my first job I took was in academics at the University of Florida in Gainesville. And I was I was the facial plastic surgeon for an 8-physician department. And that's really where I just did a lot of surgery and a lot of cases, a lot of difficult cases. It was a tertiary care facility. But I also started to, really at the beginning of the stage of my career, incorporate skincare into my facial plastic surgery practice. And back then, that was 97 to 2000. That's when some of the stuff was in its infancy, some of it wasn't, but that's when I started to really play with skincare in my practice. And this included topicals. And then I moved out to Colorado for the next 14 years, and that's really where I honed my skincare practice. And it was incorporating, I always thought that skin was the foundation for any anti-aging maintenance, but also treatment. So my facelift patients or my rhinoplasty patients would all be counseled at least on skincare, and a lot of times they would be placed on skincare. And so I started to incorporate this line of products called Obagi Medical Products, which is internationally known, and got to know Dr. Obagi because we were doing a lot of treatments here in Colorado. And then from between 14 and 17, I actually moved out to Los Angeles. My wife and I did, to Beverly Hills is where I spent about 2.5 years with him, alongside of him, and then really learned how he did things. So I thought I was pretty good, and I was doing protocols, and I was doing, what I thought was right. But then I really learned how to do the right peel, how to do the right protocols that he had developed, and then moved back here in 2020 and joined Veros Health, and then this whole concept with Dr. Malamed and combining immune wellness with skincare has now come to fruition.
Right. So I'm curious, when going through all of this training that you've been through, and with Dr. Obagi, who I've even heard of, did it ever, I don't mean this to sound bad or weird, but did it ever occur to you, is it ever a thought that the immune system plays a role in skin health?
Yeah. Yes.
Okay.
So one of his concepts is that chronic inflammation is a source of aging skin.
Right.
And so by about the age of 10 is when inflammation starts in the skin. And it progresses throughout the lifetime. And the treatments that we were doing were to change this chronic inflammation into an acute inflammation with maybe some kind of treatment, and then taking care of the chronic inflammation on top of that. And then there's disease processes, like rosacea is a skin condition that also has an immune mediation to it, and you can get flare-ups when your immune system is maybe out of whack or not right, and you get a flare-up in your skin. So chronic inflammation is part of aging skin. It's not everything, but it is part of it.
So I think probably most people know this, but I feel like it's important for those who might be new to this to when we talk about the acute and the chronic, acute inflammation is short term, right? It happens. So you cut your finger, you have acute inflammation, and you have an inflammatory cascade that comes in, and then the anti-inflammatory cascade that comes in order to squash it, and so then everything goes back to normal. What happens though, so often, and what we're finding in our world of toxicants and unhealthy food and stress and lack of sleep and infection and you name it, is what should be acute inflammation that goes away becomes chronic and is long term. And so chronic inflammation can either be severe disease processes, or it can be this underlying, I always see it as a fire, so this underlying sort of low-grade fire that is still creating significant issues that we see as disease or dis-ease, right? Or even just as symptoms, right? Is it a headache? Is it a stuffy nose? Is it joint pain? Is it a stomach ache, right? What is it that is underlying that continues to push these symptoms? And I can't help but to say that, so often, I mean, what my goal is when I'm working with people is just help you to understand what this means. Help you listen to your body, because your body's always talking to you. And so if we listen, if we understand that this symptom is the body saying, hey, I need your help. I call it knocking on the door, right? Hello, I need you to pay attention to me. What can we then do to seek out answers to understand the root cause of this inflammatory process or this symptom in order to then squash that fire, right? We got to put the fire out. So, carry on.
Well, I think, some of the causes of like chronic inflammation in the skin are sun exposure, which just about everybody knows. Other diseases, maybe you have a skin disease, like I mentioned, rosacea or lupus, can cause inflammation in the skin. Oil causes inflammation in the skin. Most people think that oily skin may be very healthy, but actually oil is an irritant to the skin. So any disorders of the skin that have oil, whether it's a genetic condition, or it's rosacea, which is a disorder of the oil glands, or acne, or seborrhea, all these have oil in the skin. But other stressors, stress in life causes increase in C-reactive protein and sedimentation rates. Poor sleep, and we may go into that a little bit later, causes increase in stress in your body. And so all these then can come out through your skin.
Yeah, it's this interesting, I always see this little graphic in my head, and I've seen others who put it together, and I should do one as well, but this graphic where you have, stress really is kind of the ultimate in the main problems, because inflammation creates stress, which creates inflammation, which creates disease, which creates inflammation, which creates stress, which creates more symptoms and more inflammation and more stress, right? So it's this really can end up being this downward spiral where you start with, you know, a symptom or two here and there, and you just continue to, and I see it in practice all the time, I'm sure you do too, but where people come in and they're like, it just has gone haywire and I don't know what to do and I don't even know where to start because there's so much going on. And I was gonna ask you, this is you had said lupus. Can you talk to me, and this is kind of personal because I have a client who has been told she has skin lupus.
Mm-hmm.
Can you tell me what that is?
Well, I'm not a dermatologist, but just kind of in general,
Yeah.
lupus has both skin manifestations, but it can also affect every organ in the body,
Right.
whether it's the brain
Mm-hmm.
or the heart or abdomen. So skin lupus is really the what you see on the skin, that the antibodies that are attacking your body are actually attacking the skin. Yeah.
Interesting. So why would there be a differentiation between lupus and skin lupus, or should there not be?
I don't know if I know the exact answer to this. I think it's really what the patient is experiencing.
Yeah.
Is maybe the patient is only experiencing the rash of lupus, but or are they experiencing, you know, something really more severe that's affecting the brain or other internal organs? So it's probably really, you know, from a diagnostic perspective, it's you have lupus and it's really just affecting your skin, or maybe there's another diagnosis of you have inflammation in you have myocarditis, maybe due to it. So that's kind of my take on it.
Okay. Yeah, little bit of an offshoot there, but you know, so the body is so amazing and so beautiful, and I think what I was talking to a client that I have yesterday, or actually she's a potential client, and I say this a lot, that, you know, people get really frustrated with what they're struggling with, but I think that if we take your struggles and support the body and have an idea that the body is here to support us and it's trying to keep us alive, and all it's trying to do is tell us that it needs help, it can change our perspective, I think, and our mindset when it comes to, okay, my body's fighting me, what's going on, to what can I do to support it so that it's able to do its job. And, you know, I think, you know, switching that mindset a little bit can be really helpful when we're trying to get people through, you know, some of these chronic issues that they're struggling with. So I think that's a good segue, is what do you consider healthy skin?
So Nikki and I were talking about this earlier in the week, is that there's really hasn't been a good definition of what normal skin. If you look in the dermatology textbooks or plastic surgery textbooks, there's a little section about what normal skin looks like, maybe on the microscope, histologically. But what is it externally? What does it look like? And maybe if you ask a dermatologist what is healthy skin, they can tell you what's abnormal with these disease processes. And so Dr. Obagi really is the one who came out with a definition of normal skin or healthy skin. And I really like to look at skin, whether procedures and creams are really to bring your skin health, and when you bring skin to a healthy state, it looks better. So it incorporates into that definition. So I look at healthy skin as being an infant skin, and that's what I always have in my mind. Maybe when I see a patient for skincare, is that I look at that patient's skin and I say, how is that different than an infant skin? So an infant skin is smooth, it's even in color, it's firm and tight.
No wrinkles.
Exactly. It's hydrated. It's not dry. Kids don't need moisturizer. It's tolerant. It has a strong barrier to it. It has full contour, and it's free of diseases. There's skin diseases that can affect infants, but if we look at a healthy infant, that's what healthy skin is. And that definition is not in textbooks.
Right. And so interesting too. I mean, we have, I would assume most things we'll talk about what's normal, and then where there's dysfunction, right? But not the skin.
Right. Well, in medicine, you have to know what normal is to be able to diagnose what's abnormal. Because if you don't know what's abnormal, then you can't make that diagnosis. So you say for the heart, you have to know what normal heart sounds are in order to identify what's an abnormal heart cell.
Mm-hmm.
I think of that same way for skin.
Yeah.
So skin should have a healthy barrier function. It should have normal turnover of cells, and it should lack chronic inflammation.
Mm-hmm.
Those are some characteristics of healthy skin.
And so what do you see? So if you have, say you have abnormal turnover of cells, what happens?
So you can see abnormal turnover of cells in aging skin. So in aged skin, that turnover is decelerated. So the normal skin turns over in 40 days. So if you take the skin cell that has just been developed from the basement layer of the skin, or where they generate, and you look at how long does it take to come to the top of the skin and exfoliate, it's 40 days.
Okay.
So with aged skin, it's longer than that.
Okay.
It's called the KMU, or the keratinocyte maturation cycle, but that's basically the skin cycle. In some diseases, like psoriasis, that cycle is shortened.
Oh, interesting. I didn't know that. Okay.
Yeah. So this is the normal turnover in skin. So when I look at putting patients on topical regimens, I tell patients you have to go through 3 skincare cycles, which is roughly 4 to 5 months. And that's how long it takes to get kind of that old skin off, get new skin growing. And I use retinoids in my practice, and retinoids really work at that basal layer, that layer that's where the skin cells are being formed. But it takes about 3 cycles of skin to get it in a more healthier state.
Interesting. And retinoids are essentially a vitamin A derivative, yeah?
Right.
Yeah.
Right.
Cool. Are they, I can't help because this is what I do, are they synthetic, or is it natural retinoids or retinols?
Yeah, so there's different types of retinoids. Retinol is one. We see that in a lot of over-the-counter products. Retin-A or tretinoin is your pharmaceutical grade.
Okay.
And then there's other retinoids like retinaldehyde, so you might see that in a product. Tretinoin is a stronger version of retinol, but they all are going to work on that basement layer of the skin and affect the DNA actually in those cells.
Really?
Yeah, so that's why I tell all my patients they should be on some kind of retinoid for the rest of their lives to keep their skin young and healthy. And it's the only thing that really will keep collagen stimulated for a lifetime.
Interesting.
So I try to get my patients to be on retinoid.
I need to be on a retinoid.
You should. If you're not, that's right.
Good to know. All right, cool. So what are, so if we're looking at, well, I guess, you're doing medical procedures, and you're doing, so what kind of medical procedures are you doing? So I know you're doing, the rhinoplasties.
Right, so if I look at someone who's come in just for aging changes, let's say like facial rejuvenation, my recommendations are split into 4 categories.
Okay.
1 is skincare, 2 are lasers, 3 are injectables, and 4 are surgeries. And everybody's different.
Sure.
Everybody has different recommendations based on what's on their exam. So I don't do anything on the body. I'm a facial plastic surgeon, so I stick to my training. But from a surgical perspective, I do facelifts, I do brow lifts, I do rhinoplasty, chin augmentation. We'll kind of work our way backwards. Injectables, I do fillers and neurotoxin, which are also known as Botox. Lasers, so lasers are interesting because in the beginning of my career, I was involved with developing a laser center for the University of Florida, and I had lasers in my practice. But as I have been doing this for a while, I really put lasers as secondary for skin treatments, and that's really opposite of the market.
Okay.
The market is really device driven. It's laser driven. You go to a med spa, they're going to actually recommend a laser treatment. They might talk to you about skincare. They may not, but they have a laser that they need to pay off. So, but in my practice, my lasers are secondary. They have a position, but I really think as skincare as the basics for everything.
Yeah.
And so for skincare, it should be kind of like dental care, and we talked about this earlier. dental care, you take care of your teeth. You brush it twice a day for a number of different reasons. One is to be clean and healthy, but also to prevent disease. And that's how I look at skincare.
Mm-hmm.
It should be done twice a day, and you do it to keep your skin clean and healthy and to prevent disease. Now, like dentistry, you have to sometimes have procedures, like a filling or a root canal. Same with skincare. Sometimes you need to get rid of that chronic inflammation with a procedure, such as a peel, or maybe a procedure to decrease wrinkles, or in extreme cases of facial laxity or surgery. But really, skincare is still the basis of everything that I counsel my patients on.
So I want to get into, there are a couple of things I want to get into. One is the internal, right? So with the internal, one of the things that Dr. Melamed says is, the skin is the mirror of the immune system, and I think that makes a lot of sense. What we put in it is what comes out. But, and you and I talked about this a couple of days ago, what I have to say, and I have to do a little bit of a rebuttal here for anybody who's listening. If you've listened to me, I'm going to say never get a root canal. Ever, ever, ever. If you've if you've had a root canal, go to your biological dentist, have a cone beam scan, look for infection. My understanding, what I've been told, I'm not a dentist, I'm certainly not a biological dentist, but you can get a cone beam scan, it can tell you if you've got infection. They'll tell you 100% of the time root canals are infected. So these gram-negative bacteria, they sit in these vesicles underneath and in this jaw area, but they're all connected to capillaries. What does that mean? It's going to go systemic. And so what can that lead to? Well, it can lead to inflammation. What is that going to lead to? All of the things that inflammation causes, which is chronic disease and worse, right? So just be really aware of that. Yes, procedures are necessary. We have these acute situations where things are, these medical procedures are absolutely necessary. But in the case of something like a root canal, do your research. You got to do what's right for you. Make your own decisions, but do your research and really get a cone beam scan, because that's going to tell you what's going on and what needs to be done. Okay. I gotta say it.
But I think what you're saying is really prevention is really the best medicine, right? And you want to prevent from having a procedure if at all costs.
Yeah.
But sometimes it's hard. Sometimes it's genetic. You have a genetic. Your teeth are genetically prone to this, to cavities, or gum disease. But you have to do what you can do as much as you can to control that, and take care of and maintain things before it gets to the point of needing procedures.
Which is the beautiful thing about epigenetics, right?
Okay, tell me about epigenetics.
So,
okay.
Well, epigenetics, it's funny actually, because the first time I met Dr. Melamed, he starts talking about epigenetics, and I just thought I might run over and hug him. Because it's like, yes, I love this so much. I love epigenetics. If you know me, I talk about it all the time. It plays such a huge role in everything we are and everything we do and everything in our future. So, super quickly, the down and dirty of epigenetics, we have our genetic makeup. On top of our genes, we have locations called single nucleotide polymorphisms. You can call them SNPs, you can call them variants, but we all have them. I don't know how many millions of them we have. I have no idea. But what they do is they regulate the presentation of genes, essentially, right? And so the expression of genes. So due to our factors that we have very much in our control, food, stress, sleep, movement, everything that's in our life, these are the things, for the most part, that turn these SNPs on and off, that turn on and off the expression of genes. And so, for example, cardiovascular disease, we can have which I do, cardiovascular disease all in our family. Or autoimmune disease, which I do, all in our family. And people will say, or diabetes, you just name it, right? It goes down the line. People will say, well, it's in my family, it's just how it's going to be. But it's not true. If it was based on our genetics, yes, but it's based on our epigenome in large part. And we have the power to make the decisions in our life to help to regulate, to mitigate disease for today, for our future, and then for 7 generations ahead of us. And that's where I love so much is, you know, working with couples who are planning for pregnancy. Now, who are already pregnant but are planning for pregnancy, because your health today can impact generations ahead. And so, yes, there are things that are out of our control. We can't control the toxins that are in our air, right? But we can control the toxins in our home environment. We can control what we put on our skin. We can control what we clean our homes with. You know, we can, you know, pray and meditate and eat well. Nobody's perfect. I'm certainly not perfect. But it's in my mind what I make. My choices today are going to impact my health of the future and my mindset and all of these things. So, epigenetics in a nutshell, my favorite thing maybe ever. Gives us so much power, which is beautiful, right? It gives us a lot of power. So, going to then the internal and how it can express on the outside, you know, we're talking about inflammation, but if we're eating well, the inflammation stays low typically, which means our skin should be clearer, right? For the most part. And our wrinkles should be less. And so that's the fun part about our collaboration, is that we come together and put together, it will be putting together, we're still working through a lot of these processes, but these programs and protocols for patients that are it's inside out and outside in. Yeah?
Yeah, I'm excited to incorporate this and learn more about it. So this is the beginning of a collaboration of how does something internally affect the outside, the skin. There's some practice of putting patients on anti-inflammatory diets before surgery. There's a well-known rhinoplasty surgeon named Dean Toriumi who has the Toriumi diet, and he has written a textbook now and the anti-inflammatory diet, and he puts patients on a month before. So I'm hoping that we can figure this out. I'd like to get your take on that. I need to be on an anti-inflammatory diet my whole self.
We all do.
And but you know, I'm also interested in seeing how maybe IV nutritional treatments are going to affect healing, maybe in patients who don't heal as well, and using IV nutrition. And maybe you can tell us maybe what these IV nutrition treatments are.
Man.
Am I allowed to ask you a question?
Yes.
Okay.
This is This is a conversation. Okay. So you do whatever you want.
Okay.
So yeah, I think that what is so fun about having a wellness center is bringing in so many different types of therapies and specialties and specialists into one place to address whatever that client / patient needs at that moment in time, or at any time that they're a part of the clinic, right? Or the wellness center. We should probably call it a wellness center. But yes, you know, this is exciting because I know IV nutrition. I know IV nutrition therapy. I obviously I've done it, but I can't do it. So jumping into what we have access to give people for their wellness is so, the reach is fascinating. I had no idea. I mean, there are things that we're going to be doing. I'm not going to say it yet, but there are things that we're going to be doing that I've not seen anywhere. And this is, I mean, and true amazing anti-inflammatory stuff. And I can't even talk because I'm so excited about it. So I think, protocols, you know, your typical protocols, I think, for pre-surgery, post-surgery, you know, you want to have your amino acids, right? We want to, especially post-surgery, we want to detoxify from the drugs that are given. You know, we want to have anti-inflammatories and healing properties for the body to be able to heal and rebuild and to, you know, build the immune system and support the liver, the lymphatic system, all of these things that are involved. But going in, are we supporting by giving good, healthy, doses of, micronutrients to support going through surgery? And then getting into some of these, really superior, amazing anti-inflammatories that we're going to get into. We're not doing it yet, so I'm just not going to say it, but these really amazing properties that can boost healing significantly. On top of that, though, there are really great supplement protocols. So yes, we want to do the IV nutrition. That's a point in time that can really help, and it goes straight into the veins. Most of us already know this, goes straight in. So there's no going through the GI. There's no trying to break it down and do all these things that the body does. It is going straight in, and the body's getting 100% of what you're putting in. But then supporting with good, healthy omega-3s, and again, micronutrients and liver supportive nutrients, and glutathione. Everybody knows glutathione probably at this point, which is the master antioxidant, and it helps to recycle other antioxidants, and it needs to be recycled. And so many things that we can do that are supportive, that are not being done so often, not always. You're talking, I don't remember his name now because it's an unique name.
Toriumi.
Toriumi. But these are the things that need to happen, and this is why we bring in, all areas of care, because if we have to go through surgery, or even if it's elective surgery, we want to go through it the best we can and come out even better on the other side, right? Well,
I've always recommended, before surgery, patients take a good multivitamin, vitamin C, vitamin zinc, vitamin D, stop supplements that could interfere with anesthesia. And there's a company that makes vitamins that are safe around surgery, that have these components. But I think even putting like vitamin C and maybe IV before and after surgery, particularly someone who has a wound healing issue, maybe not someone who's healthy, but particularly in someone who has other medical problems, could help. And that's what we're going to learn, and we're going to try to figure this out. I think it is these are going to be unique programs. It's going to be a unique practice to incorporate this whole wellness side into the surgical side. And I think it's different than a med spa. This is a different thing.
Yeah. Totally agree. This is really for those who are chronically ill. It's for those who are looking to optimize. This is individualized care, and that's what we are going for. And it's important, I think, for anyone to look at a person as a person, right? I don't look at you like you're the general population, because you're not.
Right.
And I'm not. And I think it's important that when you see a practitioner of any kind, that you're seen as an individual and not the general population. And this can go into, I'm going to go into it just a little bit, but goes into lab testing. So whether it's conventional lab testing, which can also be functional lab testing, but then some of these other functional tests that can help us to understand the body, the immune system, how it's functioning. Is there something that needs to be addressed in order either to go into surgery or to eliminate systemic inflammation? We can look at infection. We can look at genetic, epigenetic markers. We can look at micronutrients. I mean, so many things that can help us, again, to truly optimize. Well, pull out of a chronic situation and to optimize. It's amazing what we can do, but the conventional comprehensive metabolic panels, they give us a ton of information. We just look at them. The ranges are just a little bit different, but these are things that give us, this is how we see the body talking to us on a piece of paper.
I'll be interested in learning all about the functional lab testing.
It'll be fun. It'll be a lot of fun. That's where I nerd out, and I still have so much to learn. There is a lot out there, but it's a gift. It really is a gift to have access to these things that really is bringing the body. I hate numbers. I really hate numbers. The only time I like numbers is when they're sitting on a piece of paper telling me what the body's saying. That's what I like. So what are there other kinds of, I mean, I feel like maybe we talked about this, but if there's anything that's like coming down the pike, anything that's advanced, anything that you think you might bring in or that you're doing that is different, that's unique. I mean, that's kind of what this practice is bringing in the different and the unique. What do you think?
Well, I think, I look at different specialties to learn from. Like I learned, the skincare stuff from dermatology, but I also, other parts of my practice, I'm always looking at other specialties to see what they're doing, or maybe taking an instrument from, a different specialty and bringing it in. But I think my practice is unique. I do a lot of nasal surgery. We'll focus on that. So a lot of rhinoplasty, but the trend for rhinoplasty now has gone back to a technique that was 100 years old. It's called preservation rhinoplasty. So the traditional way to take a bump down on the nose was to basically shave the top off and then close the bones together to avoid it from being flat. But now this technique of preservation is where basically instead of taking the bump down, you take out tissue underneath the bump and push the bump down. So I've started to incorporate preservation rhinoplasty in the past probably year or so. And that's a newer technique, but it's really it's now worldwide that surgeons are incorporating this, and it's turning the rhinoplasty world upside down. So I always want to try to keep up on the latest things, but I am also very critical of what's coming out, particularly on the skincare side. There's always devices and there's always lasers coming out. And I'm to the point in my practice where I don't like to offer things that don't have a high rate of patient satisfaction. So if it's less than 80% satisfying to a patient, I don't like to bring it in my practice. I mean, that's just my philosophy. We're kind of diverging a little bit.
I mean, 80%, no, it's good. 80% is pretty high, so I think that's amazing.
I don't like complications in my practice. I don't like patients being unhappy, and I like to do things that work. And so I have to weed out the things that don't work. And so I'm a skeptic. I'm a very skeptical about a lot of the newer things that are coming out in skincare. I think the basics are what I've mentioned before. But there's always new things that are coming out that I'm evaluating, and some of them I'll incorporate. But example is this preservation rhinoplasty. There's a new type of facelift, a newer type of facelift called a deep plane facelift. And there's different types of facelifts. A facelift is a procedure to really tighten the lower face and the jawline, and it's incorporated with a neck lift. So the myth is that patients think that facelift is like everything, like the eyes and the brows, but that it's a very specific procedure. So there's a newer technique called deep plane that's really patients are really catching on to. I'm offering that. I do that. I learned this 20 years ago, or more than 20 years ago. But I offer to some patients, and I customize my facelift to the patient. If they have a little bit of laxity, they don't need a deep plane facelift. But that's just my practice. I think this incorporation of the inflammatory diet, these IV nutritional therapies are going to be something really new and exciting. But those are some of the newer things, at least in my practice.
Yeah, that's great. Let's do this. Let's kind of jump into, because you have other specialties and they all do go together, sleep, right? I mean, everybody struggles with sleep, and it's an epidemic and it's a problem. I think there are a lot of reasons that are underlying that can be addressed, but let's talk about sleep and what you're doing.
Yeah, so this is an odd combination of why would a facial plastic surgeon be interested in sleep? The way I became interested in sleep is during my fellowship in facial plastic surgery, I learned a number of different surgical procedures for sleep apnea that this protocol came out of Stanford. So I came from a surgical side of treating sleep apnea, which is, sleep apnea is a condition where essentially the throat collapses and blocks the flow of air into your lungs. So apnea means stopping flow. And so these procedures were meant to enlarge the throat and the airway to allow flow to occur. Well, and that was again in 95, 96, where we were doing the Stanford protocol. And it just happened that when my next throughout my career, I was taking care of a lot of sleep apnea patients from the surgical side. I became board certified in 2014 in sleep because timing was important for taking the exams, but also I was seeing all these sleep patients. And then when I took my board exam, sleep apnea is only 20% of all these sleep disorders.
Interesting.
And there's all these other sleep disorders that, at least that I'm aware of. I don't treat all sleep disorders, but I can diagnose them, like insomnia or restless legs. And a lot of people with nasal obstruction, in my nose practice, they probably 50% of those patients have sleep apnea. So I basically, this pathway into sleep came originally from surgery, but now it's kind of gone through my nasal practice, and now it's going to come into this anti-inflammatory approach to some of our patients. So I read sleep studies, home sleep studies. I start patients on CPAP. I diagnose sleep apnea, and if they don't tolerate their mask, they might refer them to a dentist who specializes in sleep for an oral appliance. So if they've exhausted non-invasive options, then there are other surgical options, and there's even in-office options now to improve nasal airflow without having surgery. One's called Vivair. And so there's all these interesting procedures that connect with sleep apnea, which disrupts sleep in a lot of people. And as you
it can be deadly.
Yeah, definitely. So moderate to severe sleep apnea has a higher risk of heart attack, stroke, and sudden death. So CPAP is really the mainstay of treatment of sleep apnea. It's basically pressure, a puff of air that's put into the throat to keep the throat from collapsing. That only came out in the 1980s. It was developed by a physician in Australia who used a Hoover vacuum cleaner motor for the first CPAP machines. So before, if you can think about this, before the 80s, patients with moderate severe sleep apnea were either dying in their sleep or had a higher risk of having a heart attack, or they were getting maybe a tracheostomy, which is not really that great, to walk around with having to have a tracheostomy. So sleep has just been really interesting to me because it's an ear, nose, and throat disorder, or a head, neck disorder that I was trained in, that affects the whole body. Every single cell in your body is affected by low oxygen levels that can occur with sleep apnea. So I just think of it as a fascinating disorder that affects the whole body.
Do you work with kids?
I don't much anymore. I used to. I do some facial plastic surgical procedures, like for cleft lip and palate. I had a lot of training in that for patients who had nasal problem, deformity from cleft lip and palate, or ear pinbacks. Used to reconstruct ears from rib cartilage called microtia, but I don't do that anymore. It needs to go to centers where people are doing it a lot to really get good results.
Okay. I'm curious because as we're talking through sleep apnea, there was a group I used to know. They're no longer around, but I know that there are others who are doing it. I think it's more the dental community, but there is a situation where, in my understanding of it, is due to probably due to a lot of things, but due to the health of mom, micronutrient deficiencies, the lack of development and the lack of full genetic development, right? So kids' throats, their esophagus, their air pipe, right? I'm not very clinical right now. Anyway, it's small, right? It's too small for them to breathe well. Their jaws are pushed back. They're not fully developed, but there's not the understanding that they're not fully developed, and so their mouths are too small for their teeth, right? And things like that. And there are, my understanding, procedures and things that can be done that are not braces, right? So we're giving kids braces and removing teeth when we're not addressing the full structure of the body to help them to develop into their full genetic potential, which would help them breathe better. So I think there are appliances and things that we can do to you know what I'm talking about? Yeah. Fascinating stuff.
Yeah, so the dental community has really embraced sleep. And so there are syndromes that are associated with, say, small jaws. And Pierre-Robin sequence is one of those. But there's also toxicities that are associated with small gels, like fetal alcohol syndrome. And I think now there's just something that came out with fentanyl exposures that are associated with burn defects. And so the dental community has come out with, there's a big interest in sleep on the dental side, because they're also interested in the, how the teeth affect the whole body. That's their approach, right?
Yeah.
And so there are oral appliances. There are systems to expand the palate orthodontically, or really not even orthodontically. That's not correct, because that's braces, with appliances, mouthpieces to expand the palate. And I work with some dentists who do that. I refer my sleep apnea patients to sleep dentists to make their oral appliance. And they have actually some of their own procedures that they do in the throat that I don't know enough about to make a judgment. Okay, these are good or these are not. But at least in my practice, I think I have a good overview of the treatment options for sleep apnea patients. And I'm not just doing one thing, which is surgery. And so when I go through my talk with sleep apnea patients, I tell them there's 5 options for treatment. One is weight. Weight gain will make it worse, or if you're overweight, then weight loss will help your sleep apnea. 2 is CPAP, which is kind of the gold standard. 3 are oral appliances. 4 is nose and throat surgery, and 5 is an implant called Inspire, which stimulates the tongue. So I offer all those.
Stimulates this tongue.
Yes. So.
What does that mean?
Okay. All right. Yeah. So this is like a pacemaker for the tongue, and it's a small battery. That's a pacemaker battery that's implanted in the chest, and it has 2 wires. One wire goes to the nerves that control the tongue, and the other goes to the chest. And basically, patients will turn on this remote, use a remote to turn it on at night. In about a half hour, it'll start to stimulate the tongue forward.
Wow.
And that opens the throat. So it's out there. I do that in my practice. There are patients who are good candidates, and there are patients that aren't. But I think this is what I try to do, is I try to offer all the options instead of having one option saying, okay, this is all you're going to do.
Good.
So that's kind of part of
individualized care, right?
That's right.
That's what it's all about.
Yeah.
Very cool. So much good stuff. So let's do this. We have a few minutes left. What are things that we should cover, that you want to cover, that we haven't covered?
Oh wow. Okay.
Okay,
let's talk about moisturizers.
Okay.
Okay, the conventional knowledge that's being distributed by all the magazines is that you should start, particularly women should start using moisturizers at a young age, because that's good for your skin. Well, it's not actually true, because again, if we go back to the infant skin, infants don't need a moisturizer. What moisturizers do is they alter the skin barrier. The skin barrier is that very top layer of cells that are dying and ready to exfoliate. But they also provide a purpose of preventing water from being evaporated from your skin, transepidermal water loss. So there's this notion, and it's been promoted by the cosmeceutical industry, the magazines are all telling this, but actually moisturizers, chronic use of moisturizers is not good for your skin, because it changes your barrier function, and it brings out more sensitive skin. So if we look at infants where there's really very little skin sensitivity, you take a 25-year-old who's been using moisturizer all their life, and they'll come in and they say they have sensitive skin. So what I try to do is I try to get them off their moisturizer, put them on a topical regimen that will help improve that barrier function. And then if they need procedures, then their skin is more conditioned to take the procedure.
Yeah. I love that. A lot of it, because in the, what do you call it, the skinceuticals industry? Is that what you called it?
I call it skin, but I was just, cosmetic skincare, over-the-counter skincare industry.
Well, I mean, so much of that stuff, we are inundated. Marketing, we know marketing works, right? It works, and it works really well, and often to our detriment. But we have, I'm gonna say this just because I think it's really important to understand. We have companies like Neutrogena. They have trash products, they've got trash in their products, and they're damaging. It's just the way it is. right? So their sunscreen is toxic. You talk about, you know, sun and cancer, and what if it's not the sun, which usually is not. It's the products that we're putting on our skin that are changing the DNA in our cells and are creating problems. And these toxins, they also change our, they disrupt our hormone function. They are terrible. And so I say that because it's such a big one, and like they can't, you know, I don't know, they're going to come after me, but I'm not really going to make a difference in, you know, the whole scheme of things. But the point is, I think it's important to take that and to understand what is in your skincare products. And do you actually need it? And are you listening to marketing, or are you listening to somebody who knows and who actually cares about your skin? Right? So pay attention to the ingredients. Pay attention to what's going in, because what's going in your skin is going into your brain, it's going into your heart, it's going into everything, right? Your skin absorbs everything. And we have these major endocrine disruptors in these products, in toxins, in our environment, that create not just toxicity, but, you know, we have such a I'm going to use the word epidemic again, but with women who have terrible cycles, men who are developing breasts. There are these things because we have such high levels of estrogens or estrogen mimickers in just surrounded by it, that it's really disruptive. So with that being said, sometimes we can't get rid of what's in our environment, but what we can do is support the body and allow it to know how to detoxify properly, to feed it well, to rest well, right? So we can mitigate some of these things that we don't have the control over. So I did a little bit of a soapbox there, but I can't help it, because we have to be aware of what we're using in our hair, what we're washing our clothes with, what we're cleaning our homes with, and what we're putting on our skin, and our kids' skin.
Yeah, I think with you know, over-the-counter products, the marketing is so aggressive that, and the consumer is very confused about what to purchase.
Yes.
And what I found, at least in my practice, is that patients will pay a lot of money for a product at the cosmetic counter, and it won't work, but they'll still do it because that's what they've been convinced to do. If they come to my practice, they expect something that is valuable for their skin, that'll change their skin. So one of the lines that I have is PABA free. Animal, there's no animal testing done on it. But there's still chemicals in every skincare, right? Just about every skincare, and there are websites where you can go and look at a chemical, look at the carcinogenity of it, right? Carcinogenicity of it, and help, you know. I think just one example is sunscreens. A lot of the sunscreens are there. There's two types of sunscreens. There are chemical sunscreens, and there's physical blockers. For patients with quote-unquote sensitive skin, those chemicals have to be heated up by the sun to be activated to protect you from the sun.
That I didn't know.
Yeah, so both from the chemical itself being a sensitizer to the skin or making the skin reactive, it's also the heat from the sun that activates those. Physical sunblocks, which are typically those that have titanium or zinc, are barriers. And so they just block the sun, the ultraviolet rays. Right. But there's also now controversy about, okay, are these physical components good for your body? I'm not sure what to make of that. But that's just an example. So it's really hard to, I think, for consumers to figure out what to do.
It is really hard. I mean, and that's what I hear every day, and it's part of why I do what I do, because I was confused. I'm like, I don't know what the hell to do. I'm in pain, and nothing's working, and what do I do? So, you know, here I am, but that's what I wanted to do. But I want to help people the best I can. I want to teach them what I was taught. I almost said what I was learned. I want to. I mean, I love to teach, and I want people to be curious, and I want to give, you know, whatever knowledge I have. But I also want to continue to take it in. And so, so yes, agree with you that the chemical sunblocks are really problematic. The mineral sunblocks are, I think they're better. Yeah, you know, they have got like these nanoparticles that are those problematic. Maybe, you know, I think ideally we respect the sun. We get a little bit of sun. We put a hat on, whatever we got to do. You know, they have these sun-blocking clothes now that are also toxic. I mean, it's just, it's so hard. We try so hard as a society to do these things to protect us from the sun, which is natural and normal, and we have to have the sun in order to convert vitamin D. It is a necessary, I mean, God made it, right? If God made it, we gotta have it. We don't grow, we don't live without the sun. And so we've been taught to fear the sun when we should respect it, but we gotta have it.
You have to have some sun.
Yeah.
That's true.
Absolutely. So, it's seeking out the knowledge, or seeking out the people who have the knowledge, who can help to teach or to help to guide, right? And that's what my place is. I know I seek out people who guide me as often as I possibly can, because that's what I need. I certainly don't know everything. I don't know a lot of things, but I want to know a lot of things. So I just continue searching. But I think it is, more than anything else, is we can't take what we see in the news and what we see on TV as gospel, because that's how we get to this place of craziness. And not that it's all bad, but a lot of it's really bad. So yes, go ahead.
The other thought I had, the reason why chemical sunscreens are out there is that they can only make a sunscreen that has a good texture with those chemical sunscreens. So that's that smooth, silky texture, maybe the Neutrogena sunscreen out there, is because of the chemicals. Physical sunscreens have a more pasty or chalky feeling. Now, there's some good brands, but they're not going to be the same texture that you have with a chemical. That's part of the issue.
It's true. There is this consumer want, right? The consumer, I don't want to have a white face. I get it, but let's think about what that white face does versus the chemicals that are changing your epigenetic, expression, right? I mean, that's where I come from. Not everybody does, and that's okay. So it makes the world go round. We're all different, but it's like you can with toothpaste, right? I mean, there are people who like a certain consistency of toothpaste. Well, it's toxic, but that's okay. I don't like that toothpaste. It's, chalky, and it's more healthy.
What toothpaste do you recommend? What should we be using?
So there are probably three. One, I've made my own toothpaste.
Okay.
I've done that. That's a whole recipe that I can, probably, it's not hard, but
okay.
Agreed. The one that I use now is Dr. Bronner's.
Okay.
So do you know Dr. Bronner?
I don't.
So he has what's called Castile soap. You've seen it. I'm sure you have.
Okay.
But it's a coconut-based soap, and he's got a really great toothpaste. It's no fluoride, everything, and it's really good. There's another one that I think it's called, I'm going to feel bad because I can't think of it, but they have a lot of like food-based hydrogen peroxide products, and they also have a toothpaste. It's like O3, I don't know what it is. I can't remember. So that's why I should have a better notes,
Sorry,
I guess.
I didn't
but
mean to put you
no,
on the
it's
spot.
okay. It's okay. But it's good because Dr. Bronner's is great. There are some really good ones out there. I would never ever put fluoride in my toothpaste. I don't do fluoride at the dentist. Yeah, so that can be a whole other topic. But anyway, yeah, that's it's just having that awareness and going back to, in anything that we're doing, the minimal amount of ingredients. Look at the ingredients, and a great website that you can go to look at the ingredients or at entire products is Environmental Working Group. So ewg.org, you can go to them, and you can put in pretty much any ingredient, any product, and they'll have a whole list, and it'll tell you the endocrine disruptors, it'll tell you the carcinogenicity,
Right.
right? I said it. It will tell you why it's problematic. I mean, and it'll rate it. So you've got the high ratings to the really, really bad ones, and you'll be surprised the ones that you think are really good and they're really bad. Fascinating stuff.
Yes.
It's cool stuff. So yeah, utilize them every chance you get. So we're done. This is good, huh?
All done.
Yeah,
Wow.
all done. So let's do this. I always ask people where they can be found, and so you can list your website, but what do we want to say about where you can be found right now?
Well, we just moved the office, so
Yeah.
well, Do you want the address?
So,
Or
do you want to do, I guess you can do Centennial and we can do Cherry Creek? Yeah?
Well,
might as well?
it's going to be probably by Cherry Creek, yeah. So
Mhm.
the address for the Cherry Creek office, which is my primary office, our primary office is going to be 3003 East 3rd Avenue, Suite 206, Denver, Colorado 80206. That's really where is the primary practice.
Mhm. Yeah. So,
Yep.
yes, so it is in the middle of construction at this point, but yeah, it's coming. Super excited about that. Reach out, to Dr. TerKonda. He's an amazing resource. He's an amazing source of knowledge and education, and wants to give. Right. This is what we do. We want to give, and we want to give what's good for those who want it and who need it. And of course, for me, you can find me at this point, tastelifenutrition.com. You can fill out an assessment, and I'll reach out to you. We can chat about it. You could also find me soon at ImmunoWellness. And then, that's kind of it at this point, yeah? So we will be sharing a space and collaborating and partnering and having a whole lot of fun with helping people in whatever it is that they need. So thank you for this.
You're welcome. Thank you for having me.
We'll do it again.
Sounds good.
Good stuff. I appreciate it. Thanks to all of you, and we'll see you next Thursday, 10 a.m. Mountain Time, streaming live on KUHSdenver.com. See you later.